If you're young, healthy-looking, and still have high blood pressure, you're not alone. And no, it's not always your salt or your weight. This video will uncover hidden causes of high BP in young people that most doctors don't even talk about. Yes, you might already know a few reasons. But do you know how to differentiate your symptoms? Or how to find out if your blood pressure is being driven by something deeper? By the end of this video, you'll know exactly what to look for. Reason number 1. Yes, most people know kidney problems can cause high blood pressure. But did you know there are different types of kidney-related issues? One of the most overlooked is something called renal artery stenosis, a narrowing of the arteries supplying your kidneys. If you have this condition, some common blood pressure meds, like ACE inhibitors or ARBs, such as telmisartan, ramipril, losartan, can actually worsen kidney function if not diagnosed properly. Blood pressure that's very hard to control, even with meds. Sudden spike in BP after starting a new medication. BP that's higher on one side of your body. Tests like renal Doppler ultrasound, or angiogram, and kidney function blood tests, eGFR, creatinine, can help detect it. So if your BP stays stubborn, ask your doctor, could it be the kidneys? Reason number 2. Do you smoke? Or did someone in your family smoke around you when you were growing up? Even if you never touched a cigarette, just being around smokers in childhood can increase your risk of developing high BP later. It damages your blood vessels early and primes your body to react more intensely to stress. Your home environment included smoking parents or siblings. You grew up coughing, wheezing, or with frequent colds. And you might now be wondering, why do my friends seem healthy, but I'm the one with high BP? This could be your answer. Reason number 3. Ever heard of hormones like adrenaline, cortisol, and aldosterone? They're part of your body's fight or flight response, and when overactive, they can silently raise your blood pressure. Feeling jittery, wired, or on edge often. Sweating even without exertion. High BP in the morning that drops later in the day. Serum cortisol levels, 24-hour urinary catecholamines, and aldosterone-to-renin ratio are tests that help detect this. If your stress hormones are off balance, your BP won't improve no matter how healthy you eat. Reason number 4. Now let me tell you a story. A 28-year-old office worker, fit, active, no junk food. But still, high blood pressure. Her labs? Normal. Her diet? Clean. But one thing stood out, her insulin levels were sky high. Turns out she had insulin resistance, a condition where the body doesn't respond well to insulin, causing high insulin levels in the blood. This leads to sodium retention, stiff arteries, and eventually high BP. Belly fat despite regular workouts. Fatigue after meals. Cravings for sugar or carbs. Tests like fasting insulin, HOMA-IR, and oral glucose tolerance test with insulin curve can help. Insulin resistance is one of the most common and most ignored causes of high blood pressure in young adults. Reason number 5. You might not feel anxious, but your body might be constantly reacting, tight shoulders, clenched jaw, poor sleep, racing thoughts. That's stress. And it causes your BP to stay high. High BP in the morning. Feeling tired but wired. Short temper or emotional reactivity. Track your heart rate variability, HRV, or resting heart rate. Try relaxation breathing techniques or mindfulness. Avoid overtraining and stimulants. Reason number 6. If you snore loudly, wake up feeling tired, or get headaches in the morning, you might have sleep apnea. And yes, even slim people can have it. Sleep apnea causes oxygen drops at night, which triggers your body to release stress hormones, raising your blood pressure while you sleep. You wake up with a dry mouth or sore throat. You feel drowsy even after a full night's sleep. Your partner says you gasp or stop breathing during sleep. Tests like a home sleep apnea test or lab-based polysomnography can help. Reason number 7. Did you have asthma growing up? Frequent wheezing, inhalers, hospital visits? You might think it was just a childhood thing, but asthma can leave long-term effects on your blood vessels and stress response. Chronic inflammation from asthma and frequent use of steroids can alter how your body regulates blood pressure even years later. You had moderate or severe asthma as a child. You've used oral steroids multiple times. You now have high BP with occasional breathing issues. Mention asthma history to your doctor. Ask for lung function tests, spirometry. Be cautious with allergy seasons and pseudoephedrine meds. You clicked on this video because you're tired of hearing the same things: eat less salt, exercise more. But deep down, you know something else is going on. Maybe your blood pressure doesn't make sense. You eat clean, you're young, and still it keeps rising. Or maybe you just don't want to be on medication for the rest of your life. If that's you, you're not alone. And more importantly, it's not your fault. Your body is trying to tell you something. You just haven't had the full picture until now. Today, we explored the hidden reasons behind high blood pressure in young age, kidney issues, secondhand smoke, hormonal imbalance, insulin resistance, chronic stress, sleep apnea, asthma from childhood, and even your supplements and medications. But this is just the beginning. Each of these causes is deep and deserves attention. That's why we'll be making separate videos breaking down each reason, how to test for it, how to treat it naturally, and how to talk to your doctor. If you're serious about understanding your own body and finding the root cause of your blood pressure, subscribe to Healthpulse Haven now. Don't miss what could be the video that finally gives you clarity. Now, tell us in the comments which cause shocked you the most or sounds like you. Drop it below, we'll reply. Your story might even help someone else finally connect the dots. You deserve more than just a prescription. You deserve answers. And maybe, just maybe, a future without daily blood pressure meds. Let's work toward that together. Thanks for watching. This is Healthpulse Haven, where we don't just manage health, we understand it.